All right, well, thanks everyone. Great to be here and enjoy talking to all of you. I'm Philippa Clarke. I'm a social epidemiologist and a gerontologist, and I'm joined here by a great team of Grace Noppert, who's MPI with me on this project. Grace is an infectious disease epidemiologist and a social epidemiologist. And Lindsay Geipin is with us here in the back, and Lindsay is our data manager for NANDA, and she basically makes everything happen. So we're really pleased to kind of share what we're doing with our National Neighborhood Data Archive, or NANDA. I'm going to talk just quickly and briefly about NANDA and how it relates to the pandemic and what everyone's talking about here. And I'm going to pass it off to Grace, and she's going to talk a little bit more about some of the new measures that we are creating that are relevant for the pandemic. And how do you advance slides? There we go. All right. So NANDA, as we call it, is a publicly available data archive. It's hosted and housed in ICPSR. The data are based on neighborhoods across the United States, so it's completely national. It spans the years from 1990 up through 2022. We're currently working on data, adding our data to 2022. So we actually have annual metrics that will span this period so people can track changes in neighborhoods across time. Our measures are at various levels of spatial scale, depending upon what you consider to be a neighborhood and what's relevant for your research question. Most of our measures are at the census tract, which is an administrative area that captures about 8,000 people and kind of roughly captures homogeneous neighborhoods. We also have measures at the zip code tabulation area, which is used specifically often for people working with claims data, where they only have patient records with a zip code. So that is the linkage there. We also have county level data on political partisanship that Megan Chenoweth was involved in creating. And we also have data at the school district level because we have data on school characteristics, including metrics on the neighborhood and school disconnect in terms of measures of poverty and race. So ever since John Snow made the link between the Broad Street pump and the outbreak and the epidemic of cholera in London in the 1800s, we know that place is so important for understanding pandemics and their output. So we've, in this project, really been focusing on thinking about how neighborhood context and how the local area context has been important for understanding not only risk to COVID infection, but also to the consequences, the social and economic consequences of the pandemic for not only people living in different neighborhoods, but also the health and the social, the economic well-being of those neighborhoods themselves in terms of their viability and resilience to suffering and enduring business closures or racial strife, and how that has evolved during the pandemic. So we focus on creating measures that use existing secondary data. So we draw data from the census, the American Community Survey, as well as proprietary data that we have purchased and have agreements to allow to be shared publicly in an aggregate form. These data include data from the National Establishment Time Series database, which is Dun and Bradstreet data that is released annually from 1990 of the location of all businesses in the United States. We link that to Zillow data, which we're currently doing, to actually clean out the data and get rid of any erroneously coded businesses so that we can actually then create local area metrics of different kinds of resources in the community. So things like dollar stores and grocery stores. So grocery stores were really important for accessing healthy food during the pandemic. But in rural areas, dollar stores played a really critical role in being able to provide healthy food for rural residents. Other features in neighborhoods that are important for the pandemic were things like street connectivity and parks, providing opportunities for physically distant social interaction or physically distant physical activity to be able to maintain social interaction and minimize social isolation during the pandemic. So having those resources in one's community can make a big difference for mental health outcomes. We also have extensive measures on broadband internet access, which of course is important not only for telemedicine, but also remote work and remote schooling. We see that it's not only that it's the urban areas that have, that have broadband and then the rural areas don't. In fact, Detroit is a city that actually suffers from a complete lack of broadband, even though it's a highly urban area. So being able to see these things at a smaller spatial scale at the census tract is something that's really important to do. One of our most downloaded data sets is actually our voter registration and turnout measures. These are county level measures of political partisanship and voter turnout that span the years from 2004 to 2016. 2018. And what's particularly important is the measures that Megan created that look at voting histories in counties. So not just what people, like what their cross-sectional voting patterns are, but what is the history of partisanship and voting in that county over the period from 2006 to 2016. So we're currently updating, as I said, a lot of these existing measures using these data, but we're also moving into creating novel metrics related to business closures, which communities have had the most business closures since the pandemic, in what kinds of neighborhoods, and also how do those communities, how do they mirror any business closures patterning that has gone on before the pandemic in terms of the Great Recession, or even places like New Orleans, and how have they communities fared that suffered from Hurricane Katrina? How have those communities weathered the pandemic? Are they more resilient or are they more at risk? We're also really focused on developing measures that are relevant for the pandemic in terms of communities that had higher prevalence or higher density of personal services like hair salons, nail salons, tourism, leisure and gyms, as well as pharmacies and other opportunities to access care in sort of less traditional settings. We're also developing measures of historical trajectories of neighborhood deprivation and affluence. So this is looking at sort of the histories of neighborhood socioeconomic status in the neighborhood in terms of how it's been either increasing or decreasing or maintaining the same over time. Again, to get at a marker of resilience or risk to the pandemic and which communities have been able to fare better than others. All of these are metrics that we hope are contributing to this idea we've been talking about understanding the pre-pandemic period and how important that is actually for understanding what we can see in terms of resilience and risk going forward. So I'm going to pass it off now to Grace, who's going to talk a little bit more about some of the work that we're doing with the pilot projects and new data.
Hi. Okay, so first I should say we're funded by the National Institutes of Nursing Research and the National Institute of Minority Health and Health Disparities. And with the UO1 funding, we've actually been able to beef up a lot of our outreach, including giving 2 new pilot awards this year. And I would encourage you guys, if you're interested in the pilot awards, partner with us. It's really fun to get to see new projects. So one of them, I'll get into this a little bit more, but one is with a nonprofit organization that's developing and publishing data about the climate of your neighborhood with regards to LGBTQIA policies. And then the other one is actually a team that's here using AI to develop a novel measure of neighborhood accessibility. So the first pilot is the MAP, Movement Advancement Project. And so what MAP has done at a national level is they've gone through national level policies and state level policies and said, marked them, are they friendly for LGBTQIA populations? And they have a gradient there. What they're going to be doing with NANDA is actually looking more in depth at local neighborhood level policies and creating that index at the neighborhood level. And then we're able to publish neighborhood level metrics on how friendly that environment is for LGBTQI populations. The other one, which is the team that's here from the University of South Carolina, is using different AI technologies, as well as I think Google Street View, to develop neighborhood measures of wheelchair mobility index. And this actually speaks to kind of one of our long-term goals of NANDA, which has always been to understand how accessible the neighborhood is for disability. So we're really excited about these pilot projects, and we're hoping to have more to report next year. In addition, we've been hard at work since we got the UO1 in creating other novel measures that help us understand the social context around the pandemic. So that includes a neighborhood measure of essential workers and businesses, policing and police encounters, LGBTQ policy, a little bit different than what MAP's doing, and then work by a really amazing undergrad that we have on how categorizing businesses with regards to how high risk they are for pathogen transmission. So the essential worker, and I'm going to pull a Coulter here, and I'm going to give you just a little snippet and hope that you'll ask us a lot more questions later. So the essential worker is going to be at the census tract level primarily, and it's going to be the distribution of essential workers by census tract using the Bureau of Labor Statistics SOC codes, or the Standard Occupational Classification codes. And early on in the pandemic, the ACLU defined which SOC codes they deemed as essential, part of the essential workforce. And so that's what our measure will be based on. There's a little bit of state variability because states could have changed that a little bit, but we think that that'll give a pretty good starting point. The policing and police encounters database has actually been a lot more difficult than we thought at the onset, but we're getting ready to publish our first data set that is a neighborhood level measure of fatal encounters. And we've used data from two nonprofits, the Fatal Encounters group and the Mapping Police Violence. We are also working on a data set of non-fatal police encounters, but we have, and I'm happy to talk more about this, but we've run into a lot of obstacles in getting some of the data that I think is intentionally obscure around this. For the LGBTQIA policy environments, so again, we're working with MAP. We're also looking at the density of LGBTQ plus community centers in a neighborhood, and that's using data that we're partnering with all these folks, and they've been so gracious to work with us, using data from Centerlink in the community of LGBTQIA centers. And so that final data set will have neighborhood metrics that tells you how many of these places are in a particular census tract or zip code. And then the work that our student is doing, and I should say John has been really helpful in this as well, is using the NETS data. He has developed, Andrew, our student, has developed a matrix of either high congregation or high contact and classified businesses according to if they're a place that you would likely run into somebody else, how many people are typically in that business. And so by doing that, we'll have a neighborhood measure of how many high risk businesses for respiratory pathogens are in a particular neighborhood. So he's actively working on that in the midst of his coursework. So that one's a little bit slower coming, but I would say it's probably in the next year. In 2021, we also launched the COVID Neighborhood Project, which was in response to the lack of spatially referenced COVID case data at the national level. So there have been a number of really amazing projects that have looked at spatially referenced case data, but they've been primarily in urban areas, sometimes groups of cities. The Big Cities Health Coalition did a wonderful job at this. But as far as a national data set, we haven't had one other than at the county level, which misses a lot of heterogeneity happening within neighborhoods within counties. So we launched the COVID Neighborhood Project in 2021. We have 21 states that we have spatially referenced data at the census tract or zip code level for. We are actively trying to get funding for this project as its own kind of adjacent to NANDA. So this is a map. So this was funded, the initial pilot work was funded by the Network on Life Course Dynamics and Disparities. And what this map is showing is the number of cases per 100,000. So the more red you get, the higher number of cases per 100,000. And these are the 21 states that we have. And the only thing I want you to see from this is that there's significant heterogeneity in the distribution of cases by states. This work is currently under review after an R&R. So we're hoping that that preliminary work will give us a little bit of boost in the grant review process, but we'll see. So eventually the COVID Neighborhood Project data will be publicly available as well. And it will be a national data set that will be available through ICPSR and linked with NANDA. So we're hoping to be able to report some good news about that. We have a great team at NANDA. We are huge and we have so much fun, and we're so thankful for the people that make this work possible and bring such a unique and diverse perspective to the work that we're doing with neighborhoods. So I will leave it with that and thank our funders. We also have NANDA flyers up here. Philippa brought them in. So if you're interested in NANDA, and they have a QR code that takes you right to our site. And lastly, I want to thank all the SBE CCC people that organized this, John and Megan. You guys have done such a nice job, and we're really grateful that you invited us, and we're happy to be here. If you have questions, please track one of us down. Lindsay's in the back and Philip and I, or send us an email. Thanks.